Hi, my name is Elizabeth Hugh, and I'm a cornea, cataract, and refractive surgeon at Virginia Eye Consultants. I have been so excited about utilizing the iTrace specifically because it helps me with efficiency and accuracy in objectively diagnosing my cataract patients and for me to better understand how they are actually feeling functionally as they're going through their daily lives. I have a patient who I first met about 6 months or 9 months ago for a cataract evaluation. Actually, it was a LASIK evaluation. He's only 32 years young. He's quite a high myope. So I was already thinking if I was going to do anything even before I met him, it would probably not even be LASIK surgery, but it would be in the ICL range as he runs in the -10 to -12 diopter range. But let me quickly go through. So even before I go into the EMR, I can quickly run through my iTrace exams, and it gives me a ton of valuable information. So going through the dysfunctional lens index, I can first see one, how regular or irregular their qualitative astigmatism is, and I can absolutely tell that this gentleman has great regular with the rule astigmatism. The Tracy refraction here, as you can see, gives me absolutely the patient's true refraction. So I understand what they are in terms of how highly myopic, what their astigmatism refractively looks like. And it also gives me a sense of the quality of their cornea. So this patient looks like, except for the fact that, there's a little bit of blur to their image, and that's probably because of the higher order aberrations and the amount of astigmatism, but it's not a surface issue. And then, wow, this DLI is definitely in the moderate lenticular change, which I would not have expected. I, in fact, had him rescheduled to come back and see me again because the posterior polar or slash PSC was not that impressive. He's was 20/20 and batted down to 20/25 before, and on today, before seeing him, 20/25 right eye, 20/20 left eye, batting down to 20/30. But now I can absolutely tell why he's saying that his reading is so bothersome, that the glare is so bothersome, and this is what his image quality is like. And similarly, the right eye, as he mentioned to me, is so much worse than his left eye is qualitatively to him. And he's an accountant, so he's constantly staring at numbers all day long. We know that anything close to the posterior capsule is going to affect their actual near vision more. So this helped me to understand qualitatively why his vision was so bothersome. So absolutely, in this younger patient, I immediately went ahead and moved down the pathway of getting him set up for cataract surgery, where I may have dissuaded him and had him wait a little bit longer. But this certainly helped me quickly recognize more readily that he definitely had a visually significant and a clinically relevant cataract that needed to be addressed.